This is a demonstration of how I inject my forehead to control my supraorbital neuralgia. I don't recommend that anybody who isn't trained in doing nerve blocks do this at home, but it might be worth mentioning to your doctor if you have the condition, in case they haven't heard that 5% dextrose helps in some cases. I've marked with attractive green dots where the supraorbital nerve exits the brow bone from here and up into the scalp, as well as where the supratrochlear nerve exits from underneath the inside of the brow up towards the center of your scalp. The injections I do are not like most of the injections you see on other videos where they go in, they inject into the area between the brow and the eye. But rather I do a simple straight line of the 5% dextrose injection from the arch of my brow so that I'm going in just lateral to where the nerve exits all the way to the top of my nose. I use an alcohol wipe. I've already drawn up the D5 or the 5% dextrose. And then I use a 30 gauge needle, which is really tiny, even though it doesn't look it. And it's actually a little stingy, but it's bearable. I go slow because I'm a wimp. But I go in at about a 30-degree angle. And as soon as the needle enters the skin, I start to inject. I can tell when I'm under the skin because there's no resistance to the tip of the needle and it slides forward easily. I'm using a 3/4 inch needle, but I'll still have to do a second injection in order to get across where the supratrochlear nerve exits. And the reason I'm doing both is because when my nerves act up here, they both start firing. Well, that's weird trying to do it in a mirror without really seeing the angle since I'm trying to look at the camera. And as you notice, I'm not pouring out blood and I don't look like I had a stroke yet. And so I'm going to go back in now and just get the rest of it. It gives you a very nice Cro-Magnon ridge above your brows, but that only lasts for about maybe an hour at the most. But it can sometimes make this part of your underbrow area a little puffy from the fluid coming down a little bit. And then I just apply some pressure, kind of push it down so that it does get down around where the nerves are exiting under the brow bone. And within about 15 or 20 minutes, the area from my brow up to the top of my scalp become numb just with the 5% dextrose. For me, the pain is usually gone for several days after each injection, unlike when I used to do nerve blocks with just anesthetic or anesthetic with steroid, which is why this part of my brow is now bald. And those blocks would only last for a couple of hours for me. So having to do them all day while I'm seeing patients, I looked like I had a stroke and my eye was swollen shut by the end of the day. With these 5% dextrose injections, I usually only need to do about one a week when I'm having a flare until the flare passes. And I have never had more than a second of pain since I started doing this. Is this going to work for everybody? I don't know. I don't think so. I don't know if it even would work for other types of trigeminal neuralgia. I have used it on patients who have herpetic neuralgia with good results, although I haven't had it last more than a couple days. But during the worst parts, it seems like the neuralgia does seem to, it definitely gets better for the next day or two, but it also seems to go away faster, but that's just anecdotal. I hope this is helpful. I would just mention it to your doctor that you heard something about 5% dextrose, which is a simple sugar solution that it possibly can help, and it has shown in some studies to help these kind of nerve pains that are so difficult to control. So thanks for watching.